In this video, we're going to talk about 5 important warning signs in your legs that could signal serious health issues after 70. You might think some of these are just part of getting older, but they could actually be your body trying to tell you something much bigger. From swelling to sudden cramps, these signs shouldn't be ignored. I'll explain how to recognize them early, and more importantly, how you can take simple steps to strengthen your legs and protect your health. Whether you've already noticed these symptoms or want to be prepared, this video is for you. Before we start, I'd love to know, where are you watching from today? Just drop your state or city in the comments below. Sign 1. Persistent swelling in your legs, ankles, or feet. One of the first signs that something might not be right is persistent swelling in your legs, ankles, or feet. If you've noticed that your legs feel heavier than usual or that your socks leave deep impressions on your skin, this could be more than just a normal sign of aging. Swelling like this, especially if it doesn't go away after a day of rest, is often a sign that your body is holding onto excess fluid, a condition known as edema. Now, many people brush this off, thinking it's just from sitting too long or eating salty foods. But persistent swelling can be an early warning sign that your heart, kidneys, or circulation might not be functioning as they should. Your heart might not be pumping blood as efficiently, or your kidneys may not be able to filter out fluids properly. Over time, if left unchecked, this can lead to more serious problems like heart failure or blood clots. I remember speaking with Harold, a 68-year-old man who noticed his legs were swelling more than usual. At first, he thought it was due to a salty meal, but the swelling didn't go away. He mentioned it to his doctor during his yearly checkup, and it turned out that his heart wasn't pumping as strongly as it used to. With some changes in medication and lifestyle, Harold managed to avoid more serious health issues. Psychologically, persistent swelling can drain your energy and affect your overall mood. It can make you feel less active and less independent. That's why it's important not to ignore it. If you're experiencing swelling that doesn't go away, or if you press on your skin and it stays indented for a while, it's time to talk to your healthcare provider. Remember, early action can make a world of difference. Don't wait for the swelling to get worse, addressing it now can help keep you on your feet for the years ahead. Sign 2. Sudden cramps or muscle spasms at night. Another sign that shouldn't be ignored is frequent cramps or muscle spasms in your legs, especially during the night. You may have woken up suddenly with a painful cramp in your calf, or felt your muscles tighten up while trying to fall asleep. While it might seem like just an annoyance or something that happens as you age, frequent cramps could be a sign of something more serious. These cramps are often linked to poor circulation, meaning your legs aren't getting enough oxygen or nutrients from the blood. It could also signal nerve problems, or in some cases, the early stages of conditions like peripheral artery disease or even a neurological issue. If you find yourself stretching, massaging your calves, or pacing the floor at night just to get relief, your body is asking for help. I spoke with Jean, a 73-year-old woman who was constantly bothered by painful calf cramps at night. She thought it was just an inconvenience. But when a friend encouraged her to see her doctor, they discovered early signs of blood vessel issues. With some medication adjustments and simple lifestyle changes, Jean found relief and could sleep through the night again, without the pain. The emotional toll these cramps can have is just as significant. Poor sleep leads to fatigue, low mood, and makes it harder to stay active. It can create a cycle where the cramps worsen and energy drops, affecting your quality of life. If you're struggling with cramps that keep you awake or happen regularly, don't brush them off. Talk to your healthcare provider. Early detection of circulation problems or imbalances can make a big difference in your overall health and help you stay active and pain-free. Sign 3. Unexplained bruising or discoloration on your legs. Have you noticed unexplained bruising or strange discoloration on your legs? Maybe a purple patch suddenly appeared on your shin, or dark spots appeared around your ankles after you barely bumped into something. While bruising can be a normal part of aging as our skin thins, frequent or unexplained bruises could signal deeper issues with your blood circulation or clotting ability. When blood isn't circulating properly, it can pool just under the skin, causing those dark patches or bruises that take longer to heal. Sometimes, this is a sign of chronic venous insufficiency, which occurs when the veins in your legs aren't able to pump blood back up to your heart effectively. This can cause fluid to build up in your legs, leading to more serious problems over time, like ulcers or blood clots. I spoke with Susan, who is 78, and she started noticing small dark spots on her legs that seemed to multiply. At first, she thought they were just age spots, but when they started to ache and spread, she decided to see her doctor. After some tests, it turned out that her veins weren't functioning properly. With early treatment, Susan was able to prevent further damage and continue enjoying her daily walks. Beyond the physical risks, unexplained bruising or discoloration can affect your confidence. You might start avoiding certain activities, like swimming or wearing shorts, because you're self-conscious about how your legs look. More importantly, untreated circulation problems can lead to infections or blood clots. One of the most alarming signs that often gets overlooked is the sudden appearance of numbness, tingling, or a noticeable loss of sensation in your legs or feet. You might notice a pins and needles feeling after sitting too long, or perhaps you realize you can't feel the texture of your socks or a pebble in your shoe. While this can sometimes be temporary, if the sensation lingers or becomes more frequent, it could indicate nerve damage or the early stages of a much larger health issue. Numbness and tingling are often linked to a condition called peripheral neuropathy, which affects the nerves outside your brain and spinal cord. For many older adults, this is caused by long-standing diabetes, but it can also be triggered by vitamin deficiencies, medication side effects, or underlying autoimmune problems. If left untreated, these nerve changes can lead to serious complications, like difficulty walking, balance problems, and even unnoticed injuries that could become infected. I spoke with Ed, a 66-year-old man who noticed he was stubbing his toes more often and couldn't feel the floor as clearly as before. At first, he thought it was just a normal part of aging, but then he stepped on a sharp object without realizing it, causing a wound that wouldn't heal. His doctor diagnosed him with early-stage nerve damage. But with prompt treatment, Ed was able to prevent further complications and regain his confidence in walking. The emotional toll of numbness can be significant. Not being able to trust your legs can make you feel anxious, and this fear can cause you to avoid activities you once enjoyed. You might even start feeling less confident in your ability to move around your home or leave the house altogether. If you're experiencing numbness, tingling, or a loss of sensation, don't wait to seek help. The sooner you address the issue, the better your chances of preventing further nerve damage and improving your mobility. Sign 5, unsteadiness or frequent stumbling. Have you noticed yourself feeling unsteady or stumbling more often than usual? Maybe your legs feel shaky when you first get out of bed, or you found yourself catching your foot on the edge of the sidewalk more than once. It's easy to chalk this up to just getting older, but if it's happening frequently, it could be a sign that your muscles, nerves, or balance systems are struggling. Unsteadiness can be caused by muscle weakness, nerve damage, or issues with your balance. If you've been less active lately or if your muscles aren't as strong as they used to be, this could affect your stability. It could also signal neurological conditions, such as Parkinson's disease or the aftermath of a stroke. Sometimes even dehydration or a minor infection can cause you to feel wobbly on your feet. I remember Mary, a 72-year-old woman who loved to tend to her garden, but she started noticing she was tripping more often. She had caught her toe on the sidewalk twice in 1 week, and that's when she realized something was off. After talking to her doctor, it turned out that her muscle strength had quietly declined, and her blood pressure medication needed adjustment. With some physical therapy and a few changes to her routine, Mary was able to regain her balance and return to her garden with confidence. The fear of falling is real. For many seniors, the idea of losing their balance can be anxiety-inducing. It can make you avoid walking, shopping, or even socializing, which only makes things worse over time. This creates a cycle where your legs become weaker and your confidence in them shrinks, leading to even more stumbles and falls. If you're feeling less steady on your feet or have caught yourself stumbling more than usual, take it seriously. Talk to your doctor about your concerns, explore physical therapy, and consider making small changes at home, like adding grab bars or using a cane. The sooner you address these issues, the more likely you are to maintain your independence and prevent a dangerous fall. Sign 6. Chronic pain or aches in your legs. Another important sign to pay attention to is persistent or chronic pain in your legs. If you've been experiencing ongoing discomfort, especially in your calves, knees, or thighs, this could indicate more than just normal aging. It could be a sign of poor circulation, arthritis, or even the early stages of peripheral artery disease, PAD, a condition where the blood vessels in your legs become narrowed or blocked. Pain in your legs, especially if it worsens with activity or when you walk, should never be ignored. Often, this type of pain is caused by reduced blood flow, which can make your legs feel tired, sore, or cramp up. For some, this pain might also be linked to inflammation in the joints, which is common in older adults due to arthritis. Let me share the story of Linda, a 70-year-old woman who had been living with ongoing leg pain for months. She thought it was just the result of getting older, but the pain started affecting her daily life. She found herself avoiding activities she once enjoyed because the discomfort became unbearable. After seeking medical advice, Linda was diagnosed with peripheral artery disease. With treatment and lifestyle changes, she was able to manage her pain and regain her ability to walk comfortably again. The psychological impact of chronic leg pain can be overwhelming. When pain stops you from moving freely, it can lead to frustration, isolation, and a decrease in overall mental well-being. It's important to address any persistent pain with your healthcare provider. Whether it's through physical therapy, medication, or lifestyle changes, early treatment can greatly improve your quality of life and help you regain your mobility. Sign 7. Difficulty standing up or getting out of a chair. If you find it more challenging to stand up from a seated position or need to push yourself up more than usual, this could be another warning sign. Difficulty getting out of a chair or standing up after sitting for a while is often a result of weakening leg muscles or joint stiffness, both of which become more common as we age. Muscle weakness, especially in the thighs and calves, can make simple tasks like standing up or walking across the room feel much harder. This can be caused by a lack of physical activity, which leads to muscle atrophy, or it could be linked to underlying conditions like arthritis or neurological problems that affect motor control. I spoke with Tom, a 75-year-old man who had started to struggle with getting out of his favorite armchair. He used to be active, but over time, he noticed his legs felt weaker, and standing up felt like a real effort. After speaking with his doctor, Tom learned that his lack of physical activity had caused his leg muscles to weaken. With physical therapy, some lifestyle changes, and simple strength exercises, Tom was able to regain his strength and move with ease again. Psychologically, this sign can affect your confidence and independence. If you're struggling to stand up, you may start to avoid social events or outings that require walking or standing, leading to a more sedentary lifestyle. This creates a cycle where muscle weakness worsens, and the problem becomes harder to manage. If you're finding it harder to stand up from a chair or get up from sitting, it's time to address it. Talking to your doctor and starting an exercise program to strengthen your legs can help you regain your mobility and confidence. Sign 8. Cold or discolored feet and toes. Have you noticed that your feet or toes feel unusually cold, or that they appear discolored, turning blue or pale, especially in colder weather or when you're resting? This could be a sign of poor circulation or a condition called peripheral artery disease, PAD. When blood flow is restricted in the arteries that supply your legs and feet, it can cause your extremities to feel cold or look pale or bluish. Sometimes, people assume that cold feet are simply a result of temperature changes or old age, but if it's happening frequently, it may indicate that your blood vessels aren't functioning as they should. If left untreated, poor circulation can increase your risk of ulcers, infections, or even tissue damage. It can also affect your overall energy levels, leaving you feeling more fatigued or sluggish than usual. I remember speaking with Ruth, a 71-year-old woman who noticed that her toes often looked pale and felt cold, even when she was inside and warm. At first, she thought it was just a normal part of aging. However, after seeing her doctor, Ruth was diagnosed with PAD, which was restricting blood flow to her feet. With the right treatment and lifestyle changes, Ruth was able to improve her circulation and keep her feet warm and healthy. The psychological toll of this symptom is also important. When your feet feel cold or discolored, it can make you feel uneasy and can affect your confidence in walking. It can also increase the risk of falls, especially if your balance is already compromised. If you're experiencing this, don't ignore it. Early intervention can help protect your health and keep you moving comfortably. As we've discussed, your legs can be a powerful early warning system for your overall health. The 5 signs we've explored, persistent swelling, sudden cramps, unexplained bruising, numbness, and unsteadiness, are all signals that your body might need a little extra care. By staying aware and taking action early, you can avoid more serious complications and continue enjoying the active, independent life you deserve. Remember, these signs aren't just part of getting older, they're your body's way of telling you to pay attention. If you've noticed any of these symptoms, don't wait. Talk to your healthcare provider, make small changes to your routine, and take steps to protect your legs and overall well-being. It's never too late to take control of your health and strengthen your legs for the years to come. The sooner you recognize these warning signs, the better prepared you'll be for a healthier future. Thank you for watching. If this video was helpful, please like, subscribe, and share with anyone who might need this information. Let's keep the conversation going. Leave a comment below with your thoughts, and let us know if you've noticed any of these signs in your own legs. Take care, and keep moving forward. Your best years are still ahead of you.